Please be aware that this is anything that you hear or see on here is informational only. We're not in the business of giving any medical advice. Uh, when a medical doctor is involved, uh, we're not really going to be looking at individual cases. If you have any questions that you would like to be answered, they'll be addressed after the presentation. There'll be a couple of the moderators will be managing it. And the way you can present your questions, and you can start anytime, even during the presentation, by going to the chat box and just go to the chat and enter your question. What the moderators will do is sometimes consolidate if there's two or three people asking the same question. And with that, I will turn it over to Mr. Mark Lichty, who is our fearless leader.
Thank you, Joe, and welcome to all of you. Today we're going to talk about the topic of anxiety, and all of us that have been diagnosed with prostate cancer have experienced a level of anxiety. What we hope is that by the end of the call, you're going to be a lot less anxious than you are now, and you'll carry that with you. You're not going to go back to that anxious place where you may have been. The issue that causes ASPI concern, and me personally concern, is that 25% of the men go off of active surveillance just due to anxiety. And we want to see if what we can do to get them to stick with it, to get them to have treatment only if they need treatment. We're not at all opposed to treatment, but only if it's necessary. And I want to thank Dr. Shu, who volunteers his time. There's none of our speakers are compensated because we don't have the funds for this. And so I want to thank also in particular the program team, but specifically here, Bill Manning on our board of directors, who introduced us to Dr. Shu. So I want to introduce Howard Walensky. He's one of our founders, but he's also leading the way to bringing light on this subject of anxiety. And ASPI, by the way, is very much involved in a national and an international survey on the subject of anxiety. So I'd like to pass this along to Howard, and Howard we'll speak of this survey and what we're doing, what's being done on anxiety on that, and then he'll introduce Jeff McLennan.
So thanks, Mark. And you almost got me into a meditative state there with your. I took a breath, and I was lost in inner space. But at any rate. Active surveillance, sometimes it's called anxious surveillance, because we have to learn when we're diagnosed, if this is the path that we take, we have to live with a certain amount of uncertainty. And recently, I think probably some of you, maybe many of you, responded to a survey that ASPI, the ANTCAN group, and also Prostate Cancer International did. One of the aspects of the survey was to look at anxiety. And what we found was about a third of you at the time that you were filling out the survey were, pretty aware of being anxious, although half of the third, if you can follow that, about 15% were anxious before they went on active surveillance. The survey also showed there were, and it's not a surprise, I think, but it confirmed that the men were feeling anxiety at certain times. They were anticipating undergoing a biopsy or a PSA blood test, or a visit to a urologist office. Those were typical scenarios where people felt anxiety. But, you know, confirming this and knowing this, it could be an opportunity to reduce or prevent anxiety if we and our doctors stayed on the game. And I think Dr. Shu will be addressing that today. And as Mark said, anxiety needs to be addressed. You know, shouldn't have to white knuckle it through, but it has a definite impact on our population. You know, in this room of 100 or so people, or 66 people, whatever, about half of us within 5 years are going to move on from active surveillance. 25% because our cancer has advanced, but 25% are going to move on because of anxiety. And so hopefully, based on our experience today with Dr. Shu and his answers and our answers to the questions that you raise, we can lower our anxiety levels. Bill Manning, who arranged this program, is up next. Thanks, Bill, and the platform's yours.
Thanks very much, Howard. Thank you all for joining us today. I met Dr. Shu about a year ago in another Zoom meeting for our local prostate cancer support group, the Informed Prostate Cancer Support Group in San Diego. And he gave a really informative talk. So I approached him to see if he'd be willing to volunteer his time, which he gracefully did for us, to speak about living and coping with prostate cancer. So very briefly, he's an associate clinical professor, Department of Psychiatry at UC San Diego, the Moores Cancer Center, Psychiatry and Psychosocial Services. He's also a board certified psychiatrist. And he splits his time between the local VA in Mission Valley and at Moores Cancer Center. So I'd like to go ahead and pass the meeting over to Dr. Shu so we can get on with our program, and I hope you get some good information out of it. Thank you. And Dr. Shu, the floor is yours.
Hello, so thanks for coming to this. So I'll be talking about living and coping with prostate cancer with a focus on anxiety, especially anxiety associated with being in active surveillance. This will be the outline of my talk. So I'll speak a little bit about just general challenges after a prostate cancer diagnosis. Pretty similar to challenges with other forms of cancer diagnosis, and then the challenges specific to active surveillance. I'll talk about anxiety and coping with anxiety, and then I'll touch on seeking professional help, ways to do that, and when you should do that. So many of you will recognize a lot of these experiences. So when someone is diagnosed with cancer, it changes your life in a lot of ways. No matter what age you are or stage of life you're in, you move from having the possibility of dying being a theoretical concept to something that suddenly feels much more real. And that, of course, if you're diagnosed at an advanced stage, that's a more immediate threat. But even if you're diagnosed with an early stage cancer, that fear is present. With the cancer diagnosis, there comes a lot of uncertainty. You don't really know what to expect with cancer. You don't know what to expect with treatment. You don't know what to expect in terms of whether your cancer will progress or metastasize. So there's a lot of things that generate a lot of anxiety. There's also a lot of symptoms that come up, both related to cancer and related to treatment. So As our field of psychiatry advances, we're recognizing more and more that depression, anxiety, other psychiatric conditions are systemic conditions. They're not, quote unquote, in your mind. They actually affect and are affected by what's going on in your body generally. One of the things that contributes to depression, anxiety is inflammation. And we know cancer increases inflammation. And so there's some association there. And then with treatment, there's many types of treatment. A lot of different things can happen with treatment. For example, in prostate cancer, some of the treatments have to do with suppressing hormones, and we know hormones are also intricately linked with mood, and so that's something that can come up. You can experience grief and distress. So grief, even though it's not that you've lost someone, you have, when somebody has a cancer diagnosis, they have to transition between this idea of themselves as being healthy to somebody who has a chronic condition. And so there is some grief associated with that. And then there's fear, as I mentioned. So I'll touch on mostly the anxiety because I think that's what is most relevant with active surveillance. But if you have questions about some other things, I'm happy to touch on those as well. So in active surveillance, these are some common experiences. Anxiety related to monitoring. So very common experiences, feeling basically okay most of the time, and then you have your appointment to get your PSA checked or to get an exam. And then that period, that lead up to it, these worries, what's going to come up? What's my result going to be? What is that going to mean for me in the future? So that's a normal experience. And when people are on active surveillance, there's often a fear that their cancer will progress or metastasize, or that by not treating it now, that they'll miss some kind of window where their cancer was curable. And then there's a very real and challenging experience of, even if you have made your decision and feel like, okay, well, I've made a decision that's best for me, you may need to manage the anxiety and fears of loved ones who might not understand why you're making the decision you are. So I want to talk a little bit about this because I think this question comes up often from loved ones, but there's not one right way to react when you are diagnosed. Everyone reacts the way that they react. Some people might withdraw for a little bit of time. Some people might seem very anxious overtly. Other people might kind of throw themselves into some kind of activities. And the way that you cope with other challenges is often the way that you cope with a diagnosis of cancer. And so that's something to keep in mind. And, if you have a loved one's asking you, okay, well, why aren't you more anxious about this? Or why, you can kind of remind them that you've reacted in a different way to things in the past. So there are adaptive and maladaptive ways of coping with distress and challenges. So some of the adaptive ways are, coming to a talk like this, or coming to other talks, learning about your condition, reaching out to friends and family. So what makes something adaptive versus maladaptive is if it enhances your ability to live your life and deal with the distress that is usually adaptive. If it gets in the way of living your life, that can be maladaptive. So whether increasing your alcohol use or other substances, avoidance, or if you do adaptive techniques like educating yourself to such an extreme that you stop doing the things that you value. So if all you do all day is reading about cancer, then that can become maladaptive. I do want to talk about anxiety because sometimes people wonder, well, what is anxiety? Why is it quote unquote bad? When is it bad? So anxiety is an emotion and it serves a function. Every one of our emotions serves a function. So we're never in the business of eliminating an emotion because that's just not possible, but also we need it. So anxiety is basically our brain's alert system for danger. It lets us know that there's something that is out there that might be threatening or that we need to take care of. And so we need to direct our attention to it. So if you think about what do you feel when you experience anxiety, you might feel kind of a little restlessness, like you're ready to move. Your heart might start speeding up or your breathing might start speeding up. Usually notice that you're kind of more alert and kind of naturally scanning your environment or scanning mentally of things that you need to take care of. Most of the time people will say that anxiety feels unpleasant. And the reason that anxiety is unpleasant is because it's that signal, okay, well, there's something that is potentially dangerous that I need to take care of. And so it makes you kind of attend to it. Now, if you think about, so there's anxiety and then there's, whether it's vigilance or it's excitement or kind of anticipation. If you think about, well, physically, a lot of the same, it feels similar. So you might feel kind of, you might not call it restless, you might excited, you're ready to do something. You do become more alert and attentive and your mind might speed up a little bit, your heart rate might go up a little bit, but it's a positive experience because it's something you're looking forward to. And so a lot of what makes anxiety a negative experience for people is that the content or the interpretation is a negative one, or it's viewing it as a threat. And so that is a helpful for a lot of people to realize, because then, okay, well, you can't change your emotion. You can't force yourself to not be anxious, but you can change the content of what you think about or, your behaviors, what you do. So anxiety is a normal emotion. We all have it. It becomes disordered when it causes some kind of impairment. So if it's so severe that you can't concentrate on anything, you try to work and you can't because all you're thinking about is cancer, for example. Whatever hobby you have, you can't enjoy it because it's ruined by your worries about cancer. You can't enjoy being around people. You're feeling tired and worn down because you're worrying so much. You can't sleep because of your worries. And if you're making decisions that on some level you recognize are not maybe the best decision for yourself, but you feel like, well, I just need to do this, or I need to change my mind about what I was planning to do because I can't tolerate this anxiety. I just have to get rid of it. That's when it can become a problem. So when it comes to active surveillance and anxiety, Howard mentioned this, but it seems like it can lead to a higher rate of moving from surveillance to active treatment independent of disease progression. And what we also know about anxiety is it's not just anxiety in the men who have prostate cancer, but also in their partners that can influence decision-making. And one of I think, when somebody is already feeling somewhat anxious about a decision that they've made, maybe they're on the fence, but they've decided, okay, well, I'm going to go with active surveillance. it doesn't take too much for the anxiety of the people around them to influence their decisions. And so if you're already kind of anxious about something, and then the people around you, especially the most important people around you, are questioning your decision and fueling your anxiety, that can change your mind. So anxiety we see most kind of at highest levels around periods of testing, and opportunities, I guess, to make a change in the treatment plan. And active surveillance, there's repeated testing. So there's a lot of these opportunities, a lot of periods where there are risk of heightened anxiety. And then we also know that uncertainty can fuel anxiety. So I think the culture of oncology, I think, there has been, there had been this phase of, well, the purpose of cancer treatment is to eradicate cancer, and in all its forms. And so there can be this view that gets communicated even unintentionally by the doctors involved in care, that cancer center messaging, that if you're not eradicating cancer, you haven't gotten, quote unquote, the ultimate treatment. And so that can also lead to a view of active surveillance being non-treatment as opposed to a treatment modality. So what causes this? I touched on this with some of the culture of oncology, but it's also just the culture of medicine. In medical school, the teaching, from first year is, well, there's a disease, and then you identify the pathological process, and then you cure or address that process, and that is what medicine is. And when you have that kind of education, that works for some conditions. The conditions it gets illustrated very well with are often infections. So you have some kind of bacterial infection, you give an antibiotic, and then infection's cured. But in a lot of conditions, in fact, most conditions in medicine, realistically, the goal should not really be cure. It should be, well, what can we do to maximize the person's ability to live their life, live the life that they want. But with this kind of culture as a background, we have this bias toward doing interventions, and it doesn't help that a lot of the incentives, financial incentives, have to do with doing procedures. And so when we have this culture and this bias, if we choose a treatment like active surveillance, it's very natural to think of that as, quote, like doing nothing or not treating it, whereas it is actually considered a form of treatment. When you feel like you're not doing something about a problem, it's natural to then feel helpless and feel like you don't have any control. You're just waiting. And so that can fuel anxiety, and then lead to you focusing on that you're going to miss it. You're going to be too late. And then you have to sit in this uncertainty about when that's going to happen. So, you can see how this would really increase anxiety. And it's all of these thoughts and beliefs there, they lead to kind of a negative interpretation of your decision and what's happening. So I spoke about, okay, well, if anxiety and vigilance and anticipation and excitement, they're all kind of similar in terms of how your body experiences. The thing that is different is the thoughts that you have about it. And, so if you can shift the way that you think about it, that can help change the experience that you're having. And so these are some techniques that you can try doing. And these are, to be clear, it's not as if you can today, let's say, okay, well, I've viewed this presentation, I've listened, I'm going to change the way that I think, and then I'm going to stop feeling anxious. It's not that quick. It's like exercise. If you say, okay, well, I'm going to get in shape, I'm going to go to the gym, you work out for an hour, lifting the heaviest weights you can. you're not going to suddenly come out of that feeling much stronger. In fact, you might feel sore and, like, okay, well, but then if you give up at that point, then you're not going to get stronger. But if you practice it, if you kind of intentionally set aside time and say, okay, I'm going to practice this. This is going to be a form of exercise. I'm going to do this, 10 minutes a day or however much time you have. That can help, you build the ability to do this over time. So some of the thoughts or cognitive techniques you can do differently. So you can reframe doing nothing as doing something. And so active surveillance, a form of treatment. So you can, if your doctor hasn't done this, you can ask for it. If you're oncologist or urologist, you can ask for an informed consent to choose active surveillance as a form of treatment, and to talk over what are the specific findings that will trigger changing the treatment plan. So it's not as passive, it's a more active feeling that you're having. When you're having prostate-related symptoms, anything you can do to manage or learn how to manage them yourself, that can help with some of the anxiety and uncertainty. And then when you choose a treatment, you want to think about benefits and risks, not just benefits and not just risks. And I think this is something that sometimes we miss. So there are both benefits and risks for having some form of intervention, and there are some benefits and risks with active surveillance. And what you need to do is be able to say, okay, well, what are these benefits and risks? How does it fit in with what my life goals are? Not necessarily what your cancer treatment goals are, because that's just part of your life, and which one of these forms of treatment fits in with what I want. And then be able to talk about the trade-offs of each options. Now, with the loved ones, when you're able to do this for yourself, you'll be able to do this for loved ones too, because they're going to have a lot of these same concerns and anxieties. And if you can do this for yourself, it's like you practice it and then you can teach it. You're teaching your loved one how to do this by modeling it for them. And so again, you're not necessarily going to convince them in one conversation. It's a process. And when they see that you're doing something active, it can change their mind that you're quote unquote not treating it. So I do want to do something, a little bit of something today, just to because part of anxiety is the cognitive piece, and the other part of it is the body piece. So there are some things that you can do to help relax your body, because in anxiety, it's a bi-directional relationship. The worries that you have fuel the tension and physical sensations of anxiety in your body, but vice versa, if you're feeling tense and physically nervous, that can send a signal to your brain telling it, well, you need to be worried about something. There's something happening. So there, I'm going to show videos for two techniques, and we'll just spend some time practicing them. One is more of a somatic technique for anxiety. The other is also a mental technique, but can help relax you as well. So, there we go.
Progressive muscle relaxation is an exercise that reduces stress and anxiety in your body by having you slowly tense and then relax each muscle. This exercise can provide an immediate feeling of relaxation, but it's best to practice frequently. With experience, you will become more aware of when you are experiencing tension, and you will have the skills to help you relax. During this exercise, each muscle should be tensed, but not to the point of strength. If you have any injuries or pain, you can skip the affected area. Pay special attention to the feeling of releasing tension in each muscle and the resulting feeling of relaxation. Let's begin. Sit back or lie down in a comfortable position. Shut your eyes if you're comfortable doing so. Begin by taking a deep breath and noticing the feeling of air filling your lungs. Hold your breath for a few seconds. Release the breath slowly and let the tension leave your body. Take in another deep breath and hold it. Again, slowly release the air. Even slower now, take another breath. Fill your lungs and hold the air. Slowly release the breath and imagine the feeling of tension leaving your body. Continue breathing slowly throughout this exercise. Try to focus on the feeling of air filling and leaving your lungs. It will be normal for your mind to wander. When it does, do your best to bring it back to the moment. Now, move your attention to your feet. Begin to tense your feet by curling your toes in the arch of your foot. Hold on to the tension and notice what it feels like. Release the tension in your foot. Notice the new feeling of relaxation. Next, begin to focus on your lower leg. Tense the muscles in your calves. Hold them tightly and pay attention to the feeling of tension. Release the tension from your lower legs. Again, notice the feeling of relaxation. Remember to continue taking deep breaths. Next, tense the muscles of your upper leg and pelvis. You can do this by tightly squeezing your thighs together. Make sure you feel tenseness without going to the point of strain. And release. Feel the tension leave your muscles. Begin to tense your stomach and chest. You can do this by sucking your stomach in. Squeeze harder and hold the tension. Release the tension. Allow your body to go limp. Let yourself notice the feeling of relaxation. Continue taking deep breaths. Breathe in slowly, noticing the air fill your lungs, and hold it. Release the air slowly. Feel it leaving your lungs. Next, tense the muscles in your back by bringing your shoulders together behind you. Hold them tightly. Tense them as hard as you can without straining, and keep holding. Release the tension from your back. Feel the tension slowly leaving your body, and the new feeling of relaxation taking its place. Notice how different your body feels when you allow it to relax. Tense your arms all the way from your hands to your shoulders. Make a fist and squeeze all the way up your arm. Hold it. Release the tension from your arms and shoulders. Notice the feeling of relaxation in your fingers, hands, arms, and shoulders. Notice how your arms feel limp and at ease. Move up to your neck and your head. Tense your face and your neck by distorting the muscles around your eyes and mouth. Release the tension. Again, notice the new feeling of relaxation. Finally, tense your entire body. Your feet, legs, stomach, chest, arms, head, and neck. Tense harder without straining. Hold on to the tension. Now release. Allow your whole body to go limp. Pay attention to the feeling of relaxation and how different it is from the feeling of tension. Continue taking deep breaths. Begin to wake your body up by slowly moving your muscles. Adjust your arms and legs. Stretch your muscles and open your eyes when you're ready. You've completed the progressive muscle relaxation exercise. Repeat this exercise daily to experience the ongoing benefits of relaxation.
So hopefully that felt good for people. The next one, as I mentioned, it's more of a cognitive technique. This one's interesting because it helps us recognize that we are not the same as our thoughts. So when we're having an anxious thought or a worried thought, it can make us really fuse with that experience. Like we can't separate from that thought. We just feel like we're in the thought, or it's just who we are. But if you can separate yourself from the worry, then it can put some distance between you and your anxiety. And so this one is a little bit shorter.
Exercise 3. Leaves on a stream. The idea behind this exercise is to simply notice your thoughts coming and going without getting caught with them, without getting into a conversation with them, not trying to control them, not getting tangled up with them, just noticing them and then letting them go. When you are ready, begin. Sit comfortably in your chair with your feet on the ground if you can, and your back straight, but not too straight, sitting against the chair. If you wish, close your eyes or have a heavy lidded gaze, maybe looking at one spot on the ground. Now imagine you are sitting on the bank of a stream and that there are leaves flowing past. The stream and the leaves can look any way you like to imagine. Notice a thought that comes into your mind and imagine placing it on a leaf and letting it flow on. Notice each thought. Imagine placing it on a leaf and let it float on. If your mind begins to wander, just notice that. And return your focus to noticing the thoughts that come to mind. And imagine putting them on a leaf and let them float on. If your thoughts stop, just imagine watching the stream until the next one comes along. It doesn't matter if they are good or bad thoughts. Just notice them and imagine placing them on a leaf and let them float away. If they hang around, just notice that. Don't force the speed that they float away on. Sometimes the leaves that pass are ones that might grab our attention for some reason. Sitting on the bankside, we could notice that attention-grabbing leaf. Let it go and watch and wait for the next leaf that comes along. The aim of the skill is to simply notice that our thoughts are like leaves on a stream, always moving on. Sometimes we think a little or we think a lot. Sometimes we get stuck on thoughts that grab our attention. But all our thoughts come and go, even worry thoughts or sad thoughts. Spending a few more moments just watching your thoughts and placing them on a leaf and letting them go. And when you're ready, begin to open your eyes and bring yourself back into the room. What was it like to watch your thoughts go by? What did you notice?
Okay. So again, these techniques,
Exercise.
they're best if they're practiced just a little bit of time each day. So the last thing I want to talk about before we kind of move to answering some questions is, well, when should you seek professional help? I mean, one answer, and one that I agree with, is that whenever you feel like it might be helpful. You don't have to have severe depression or anxiety to benefit from talking with a therapist. It can be helpful for anybody. For those of you who will, I want to know when I need to. when we consider something to be a depressive or anxiety disorder is when it becomes significantly impairing, when the depression or anxiety becomes quite impairing. So you're not able to work, you're constantly taking time off because you can't face going to work, or you can't get things done when you go to work. You're doing whatever hobbies you have and you can't enjoy them. You can't enjoy spending time with people. And this is going on for, an extended period of time, weeks or even months. And especially, if it's so severe that you think you don't want to be alive anymore, if you're having suicidal thoughts, that's when you really need to seek medical attention. And why is that? It's when we have such severe anxiety, it almost becomes self-perpetuating. You are anxious and then you're not able to get things done. That makes you feel more anxious, which makes you even less able to get things done, which makes you even more anxious. And so it becomes this kind of vicious cycle. And when you get into that cycle, you need somebody else or something else to help you break out of it. The parts of your brain that govern anxiety, they've kind of, it's like they get stuck in a loop and you need something to help break that loop. So psychotherapies can help you do that by having somebody else provide you with, okay, how can I change the thoughts that I'm having that are fueling anxiety? How can I change my behaviors so that they're not kind of enhancing your anxiety? And medications, they don't get rid of anxiety, or they shouldn't. What it does is reduce the sensitivity of those anxiety circuits to outside stimuluses or stimuli, so that you don't have as much anxiety in response to things, and including your thoughts. And so then it becomes a bit easier to interrupt them yourself or with the help of a therapist. I want to leave the National Suicide Prevention Hotline. That's if you're having suicidal thoughts or thinking about it, with suicide. Often what we want to make sure that people know about are the options. So that suicide is not the only option. There are other options. And one of these options is to call the suicide prevention hotline, or to go into the emergency room. There's always a psychiatrist there. One thing I do want to mention is every cancer center, if they call themselves a cancer center, they're going to have some kind of psychosocial treatment available. That could be a social work therapist, it could be a psychologist, psychiatrist, or a team of social workers and psychologists, psychiatrists who are attending to the mental health needs of their patients. This was not too long ago, maybe a decade or so. The process of becoming a cancer center had to include this. So if you don't know about this, you can look on your cancer center's website and they will have information about what they provide. So with that, I think we'll move to questions.
Dr. Shu, I'd like to thank you very, very much for that presentation. I would just like to make a couple quick comments before we go into Q&A. Our group, of course, is not here to give out medical advice. We are here to educate, hopefully point people in directions where they'll be able to find out more information on their own. And the questions that will be directed towards Dr. Shu, he's not going to be in a position to be answering personal questions in the manner that you might say be in an office with him. So with that, I'd like to hand over the Q&A session.
Oh, I forgot to mention, I think this came up in our run through, the PHQ-9 and GAD-7. These are self-report measures. You can search them online and you can take it yourself. And if you're scoring, above 10 on a PHQ-9 or above 8 on GAD-7, it's worth bringing up with the doctor. I just wanted to point that out because I missed that. So.
Thank you.
Bill, I've got about 5 or 6 questions that I can pass on to Dr. Shu. The first question is from Greg. Is anxiety age related? Does it decrease with age?
So as an individual person, it really varies. Some people, it decreases with age because they learn, one, it may be that they learn ways of coping with anxiety. So I saw in the chat, several people mention exercise. That's a fantastic form of addressing anxiety that is something you can do. It releases endorphins, as people pointed out. And it also helps you kind of be more aware of your own body and, so kind of with the progressive muscle relaxation. So if you, through your lifetime, amass these different ways of coping with anxiety, anxiety will be less of a problem for you because you've kind of learned ways to deal with it. Similarly, if you, have gone through therapy and learn how to address anxiety in that way, as you go through life, you may experience less anxiety. Some people experience more because the ways in which they coped with anxiety were things that they're not able to do as they age. One of those forms that's very common is a lot of people in our society cope with anxiety through distraction. In work can be a distraction from anxiety. If you feel anxious and you throw yourself into your work and you get things done, you can feel, okay, well, I'm productive, I've gotten things done, and then you don't really pay attention to your anxiety. And then when you retire, you suddenly don't have anything to occupy your mind and your attention, and then you experience more anxiety. So it really depends on the person. When we look just at the population as a whole, it seems like that's more common, is that people after certain transitions like retirement, kind of as they age, they can experience more anxiety. And then it depends on whether they've been able to find other ways to cope with it.
Thank you. A second question from Doug. Are there any published research studies that show a correlation with cortisol, which is a stress hormone, and PSA? And I guess he's asking the question in relation to active surveillance, because all of a sudden your PSA goes up as your PSA goes up as a result of stress. So perhaps you can comment on that.
Sure. We had this kind of debate about whether to kind of cover this topic. So I'm not aware of cortisol and PSA specifically. There is research into the effects of physiological stress, like increased cortisol, increased sympathetic nervous system activation in cancer. And when they look at that, there is a relationship where uncontrolled stress can affect the way that cancer progresses. The reason I don't like to kind of just bring it up, because there's not a whole lot you can do with that information other than to, okay, well, what are the ways in which I can reduce physiological stress in my life? And in a way that is why it's important to address anxiety when it's present and not just ignore it. It doesn't necessarily mean that you need to seek treatment for it, but you need to do something to kind of help reduce your anxiety or your level of stress. Often what the studies look at is, physiological stress and the feeling or the sensation of feeling stressed are different things. So when we usually think about feeling stressed, we're usually talking about tension, feeling kind of really on edge. That doesn't necessarily mean that you're having increased sympathetic nervous system activity or increased cortisol, but those can be related. The things that we find are most protective against physiological stress. So actually the most protective thing is social connectedness. We're humans, we're a social species. We need to be around people and feel connected to people. When we feel connected to people, we can often overcome and face extreme stresses and traumas. It's when we face those stresses and traumas alone and don't have somebody else or other people to reach out to, that's when we really feel that, or we really have that increased physiological stress. And and so, I guess to answer that question, whatever you can do to manage the anxiety that you have and make sure that you're involving your loved ones and not just facing this by yourself. That's the best thing you can do in terms of whatever relationship there is between stress or cortisol and your cancer.
Thank you. George asks, how long does it take to really see benefits or results on the relaxation techniques?
So I think, some people, everybody's different. Some people, and maybe some of you in the viewing this, like you did it and then you immediately notice the difference. Others, I mean, especially if these are techniques or things that you've not really done before or not used to doing, it can take several weeks before because it's kind of like same. I like using an analogy with exercise, because if somebody has already done different forms of exercise, doing a new form of exercise, it's going to come fairly natural to them. They'll know what to expect and they'll be attuned to the results. Somebody who has never done any exercise, they might try it a few times, they'll feel no stronger, and then they might give it up. And so if you're trying these techniques and you afterwards say, well, I did nothing, you might be somebody who, in order to benefit, you need to kind of practice it for a few weeks before you start kind of being able to notice the difference.
Thank you. William asks, is anxiety just an internal mind problem that indicates an idea like fight or flight from the stress of the illness?
So it's both a mind problem and like a body problem. So the thoughts you have affect your body because it sends a signal to what you are experiencing. I don't know if that makes sense, but I guess the two are linked. It's not just something that happens in your mind. Anything you think about is going to affect your body, and vice versa. When you are experiencing a lot of tension, you're going to feel more worried or more anxious, and when you feel more anxious, you'll have more anxious thoughts. And so part of what helps you manage anxiety is learning how to recognize these things happening. So learning to recognize signals from your body, learning to recognize your thoughts and the impact your thoughts can have on your body. And so when you're able to do that, then you can start changing the thoughts that you have, or start changing what you do with your body to kind of feed back to your mind, so that your mind can feel calmer too.
Yeah, I've got one from Greg from Newfoundland, which is a beautiful place in Canada. So this one's really good. Greg writes, I've recently read that giving yourself some time each day to simply get out, walk, and notice your environment, especially the natural one, can have both physical and mental benefits. And he'd be interested in knowing your views on that.
Yeah, I think 100%. We're not meant to be cooped up in boxes. We all are. So along with being a social species, we need to be around other people. Even the most antisocial, even the person who's like, I just can't be around people. If you truly disconnect completely from everybody, it is a stressful experience in its own way. And similarly, people who they say they don't like being outside. If you stay inside for too much of the time, it does create a stress. You think about a lot of experiments with animals and studying anxiety and stress. One of the ways they induce stress is by isolating them. The other is that you're putting the animal in like a box, basically. And stress goes up, anxiety goes up in those animals. Similarly with us, we do need to spend some time outdoors, being in nature, because one, that a lot of times anxiety gets associated with certain environments. And this is classic with insomnia. One of the ways in which insomnia perpetuates is you start associating being in bed with being anxious and worrying about not being able to sleep. And part of how you break that cycle is to break the association between your bed and anxiety. But a lot of times people might, especially if you're somebody who reads, wants to know about your cancer, wants to know everything there is to know, that there's a benefit to that. But if you do too much of it, you can start feeling anxious with what you read, and then associating anxiety with sitting at your computer and being indoors. And then sometimes what you need is to kind of just change your environment so that you're not having that association. So being outdoors can be very helpful for that. And then, we know there's so many beneficial links between exercise, physical activity, and mood and anxiety. So,
Thank you. That's it for the questions. I just wanted to make a comment that there were, for anybody else on the webinar, if they look into the chat, there were a few questions that were not really anxiety, not really related to the topic, but related to a specific person's diagnosis, and they really weren't questions for you, Dr. Shu, but perhaps the attendants on the webinar may be able to respond to them. So, Bill, I think, or David, I'm going to hand it over to you.
Okay, this is David Keller. I'm on the ASPE Board Program Committee, and I had a couple. Can you guys hear me okay, first of all?
Yes.
Yes.
Okay, great. I just want to make sure. And you've touched on these already, Dr. Shu, but if we have a moment, maybe you could elaborate just a little bit on the self-report test that we can run by ourselves. You mentioned a couple of tests in your talk. I'm wondering if there's a couple of those questions that might come to mind now that you could ask us to ask ourselves to give us a little indication of our, of how we're feeling. I mean, in terms of measuring our own level of stress, is it normal, high? I guess those tests measure against some sort of a standard.
yeah.
And that's what I'm asking, just around that.
Sure. So I'll point out, I guess, the G87, because that's the one for anxiety. And so with these questionnaires, the way that they're phrased is, in the last 2 weeks, how often have you experienced any of the following? And there are 4 answer choices. There's not at all, which is a 0. There's several days, so several days out of the last 2 weeks, which is a 1. There's more than half the days out of the last 2 weeks, which is a 2. And then there's nearly every day, where that's a 3. And so the G87, it is 7 questions. And let me just look them up so I don't tell you the wrong, wrong questions. So, yeah. So in the last 2 weeks, how often have you felt nervous, anxious, or on edge? Again, it's 0 is not at all, 1 is several days, 2 is more than half the days, 3 is nearly every day. Not being able to stop or control worrying. That's the second question. Again, the same answer choices. Worrying too much about different things. And again, the same answer choices. Trouble relaxing. Being so restless that it's hard to sit still. Feeling easily annoyed or irritable. And feeling afraid as if something awful might happen. And so when they've studied this questionnaire, and it's what they call a validated questionnaire, is they found that the cutoff point to where you would see quote unquote clinically significant anxiety was identified as an 8. It does not mean that if you score above an 8 that you have an anxiety disorder. It's just, it's basically like a screening test. So similarly, like, you go to a doctor's office and you get a PSA. Having an elevated PSA does not mean that you have prostate cancer. They pick a cutoff where above that number, there's some, reasonable percentage chance that you've identified somebody who needs clinical attention. So for the GAD-7, that number is an 8. And that's why, if you do the questionnaire and you score above an 8, it doesn't mean that you have an anxiety disorder. It's just something, well, it's probably worth bringing up with a doctor or trying to figure out, well, why is it that, this is happening. It is situation dependent. So for example, if normally you would score below an 8, but then you have something coming up soon that is fueling anxiety, you might have a period where you're above an 8. But then if that passes and your anxiety kind of goes back to normal, then, really the anxiety was about the stress. And, so it doesn't mean that you now need to be on a medication for anxiety. It means, okay, well, now you're kind of learning something about yourself that normally, and this is something you can kind of monitor yourself, and it can help you identify what periods of time where you're more stressed or less stressed. Something that we sometimes recommend is keeping a diary. And there are apps you can download if you look up mood diary, anxiety diary, because what that does is it helps you associate your level of anxiety with what's going on around you. So life events, let's say, you record and then you realize, oh, well, whenever, I mean, it's a very simplistic, but whenever we have a quarterly review coming up, starting around 2 or 3 weeks before that, I start feeling more tense and restless. That could be a signal to you to, okay, well, proactively, when it comes to around that time, what I need to do is kind of spend more time or increase the amount of attention I pay to the ways that I cope with anxiety and stress, because I'm approaching a period in which I'm going to have more anxiety and I want it to impact my life less. And so it's almost like a vaccine that you're taking for anxiety. So you're doing something proactive, starting to manage your anxiety before it gets to the point where you feel kind of frozen up by it. So, these are some ways that you can use these questionnaires.
Thank you very much. That was really helpful. I've got one other question, and then there's one on the chat that I'm having a little trouble understanding, but I can read it if someone can interpret it, or you can unmute the asker. But the question is, would Dr. Hsu speak to how not making a decision when a person is on AS may lead to a state of anxiety, and also when we do make a decision as to how to face our cancer can relieve anxiety? If you understand that question, great. I have a rough idea.
I think what this person Richard's asking is how, I guess, you're in active surveillance in both situations. In one situation, you maybe have not really made a decision about it. You're just kind of on it. In the other, you are on active surveillance, but you've kind of consciously gone through the steps of making the decision and made the decision. Is that what you're asking?
Richard, do you want to unmute? I don't know if that's possible.
Sure.
Please go ahead and clarify if you can.
You should be able to unmute.
Hello.
Hello.
Richard, go ahead. You can speak if you're unmuted.
What I'm suggesting is the importance of making decisions and not agonizing over what to do, dancing from one foot to the other. Do I stay on AS? Do I get treatment? Or you make a decision, I'm not going to get treatment. I'm going to remain on AS. and that's the end of it. So I speak to so many men that are trapped between not doing anything and doing something. I think that's the nature of my question, doctor.
Okay. So I guess you're saying feel it like kind of being stuck in a state of not deciding versus kind of making a decision one way or the other.
Yes, sir.
Okay. Yeah, I think there's a couple parts to that question. So one is um, when you have made a decision, of course, that can reduce your anxiety because you've kind of made peace with whatever uncertainty there might be. And you've kind of said, well, I have looked at the options. I've picked one that is best for me, and I'm choosing that. And usually, if you can get to that point, it means you've done some kind of work, whether consciously, like you've kind of sat down and written things out or kind of talked through things, or just, in your mind, you've kind of looked at the option and you just said, my gut, you can even, it's a gut feeling, like this is what is right for me. I'm just going to make that decision. And I'm going to set aside this question about whether or not it's the right decision. And certainly for those who are able to do that, that is, they'll experience less anxiety about it. For some people though, the idea that they have to make a decision and it's going to be final, that by itself can actually stoke the person's anxiety. So then if you're telling them, well, just make a decision and live with it, that is actually something that makes them feel anxious. For those people, it can be more helpful to look at it as, okay, well, I'm going to make a decision, and this is going to be the decision I make for X period of time. I'm going to revisit that decision again in however many months or weeks, and I'm going to make sure that's still the right decision for me. That can be the right approach for some people, because what that does is it helps to kind of contain the anxiety, compartmentalize it. There's a certain period of time, like I'm going to sit down again in 3 months on this day, this time, to revisit the decision. Then you know that you have set aside time, you're going to do that, and then you don't have to do it all the time in between. And so you can make a decision for a certain amount of time, revisit the decision, maybe after you've done that a few times and you've realized, I've made the same decision for the last 5 times I've sat down and done this is the right decision for me. That is related to another technique for anxiety, where it often we think, well, in order to stop having anxiety, I need to stop worrying. I need to stop thinking about this. But we can't make ourselves not think about something. There's that classic example, like, don't think about a pink elephant, and then you can't not think about a pink elephant. But what you can do is, okay, well, only at 7 o'clock, from 7 to 7:15, that's the time I'm going to worry about whether I made the right decision or not. Aside from that period of time, I'm going to remind myself I have a time and place that I do this. This is not that time and place.
I think that's a great answer, and I really appreciated that last part. This is David Keller speaking. If we have time, I have another question. I see it's Mark. Do we have time for another question? This will be coming from me, not one of the chat boxes.
Go ahead. I think we've been good about abiding by addressing the chat box question. So go ahead. Sure.
Okay. This is about the anxiety of seeing a psychiatrist. I had this anxiety because I was referred to somebody to deal with some of my anxiety, anger, and issues around this prostate cancer and some of the treatment, some of the things that were going on. And bottom line, I didn't want to be stigmatized. I didn't want some record out there or my medical insurance company to raise my premium because I'm some sort of a depressive. and I don't know if any of this is true, but I can't remember, but my psychiatrist said, well, I'm going to put you under this code XYZ. I can't remember the code. And it sounded fairly innocuous, but I was still able to get insurance coverage without it being a really ugly diagnosis, as it were, to justify submitting the insurance. Can you address that for those who want to go get some professional help but don't want to be stigmatized?
Sure. I think the diagnosis you might be referring to, adjustment disorder, does that?
That sounds about right. Yeah.
That's often the catch-all for, like, if somebody has a concern about that, and that can be, that's often the diagnosis that's used, because, like, as you mentioned, it's kind of an innocuous diagnosis. Like, essentially what adjustment disorder is, something has happened and you're having trouble adjusting to it.
Yeah.
And you're experiencing anxiety or depression as a result of that. Now, I think the landscape has changed a lot and is continuing to change in terms of mental health stigma. I think, even so, I've been in practice for about 10 years. Is it 10 years? But when I was in training, I think I perceived a lot more I don't know, and I think this is kind of an accurate percentage, the more stigma with talking about seeking mental health treatment, seeing a therapist. Nowadays, I think it's much more out there. People talk about it more freely. More and more people feel less like they have to hide that they have seen a therapist or are on medications. And so I think, the world is slowly changing. We see this also in medical students. More and more medical students want to go into psychiatry. When I, entered training, it was, relatively not a competitive specialty to get into. Nowadays, it's quite competitive, and it's considered, especially that medical students are quite attracted to and want to go into. And so, within medicine, that's changing. And among doctors, they're kind of viewing mental health treatment as really part of treating a person. So they can't just only treat that one organ system. They have to treat the whole person, and part of that treatment is addressing somebody's mental health. And then the research, we're seeing more and more that mental health is not some separate thing. It's really intricately linked with the rest of your health generally. And so we have to address these things. Some of the things that are changing in healthcare is integrating mental health in primary care and in other forms of other specialties. So nowadays, if you go see a primary care provider especially in an academic medical setting, many of them now have what they call collaborative care. So a team of mental health professionals that are part of the primary care team. And so you don't have to get a referral to a mental health professional. It's just available within your primary care clinic. So we're seeing a lot of this. Insurance, it's still kind of catching up. They still reimburse differently, which I think that is gradually changing. But that's something that we're working on, I guess.
That's a great answer, and I really appreciate it. I'll turn it back over to you, Mark.
Well, Dr. Shu, I have to say your manner is very calming, and certainly we should all have less anxiety after this session than we might have before. But I'm a little bit concerned about you. I just wanted to let you know that there's a volcano going off behind you. You might want to check that out. And by the way, Greg Smith from Canada claims that we'll find less anxiety in Canada. And so I think, Greg, if it's okay, we're going to all go and camp out on your lawn. But I did have one, by the way, I did have one more question too for Dr. Shu. So I think it would be helpful if we could get some techniques on dealing with family anxiety. And let me just share briefly in my own case. So Wendy, my wife, a nurse practitioner, was totally opposed to my going on active surveillance. In fact, back 16 years ago, we didn't even have the word active surveillance. We had the word watchful waiting, which was, that was never a good term. But, and so I shouted at her, I said to her, I asked her, what do you think I should do, Wendy, as a nurse practitioner? And she said, I think you should have surgery. And I just lost it. I shouted, I said, that's not the kind of help I'm looking for. And I don't shout at my wife, not at all, ever. And so, by the way, that was a manifestation of my own anxiety. So my question revolves around techniques for dealing with family anxiety, the anxiety of loved ones. Do you have any suggestions on that?
Yeah, I think the key with being able to address or deal with anxiety of loved ones is that you need to be able to deal with your own anxiety first. It's kind of like that analogy of being in a plane, and they say first put on your oxygen mask before putting on, for your children, because if you can't cope with your own anxiety, any anxiety from anybody else is going to overwhelm you, and it's going to potentially alter your decision making. So I think the first step is find ways to get your own anxiety under control. I think what you said is you shouted at her. That's really not characteristic manifestation of your own anxiety. If in that period of time you felt like you were dealing with your own anxiety better, you would be better able to tolerate your wife's anxiety. So I think that's like the first step. The second is then a lot of the same techniques that you use for yourself, you can help your loved ones with as well, because they're having a lot of the same worries that you would have. That if you're feeling anxious about your decision, it's probably reflecting in the ways that your loved ones are having those worries. And then if you can help guide your family member to ways to deal with their anxiety, that'd be helpful. First, of course, you have to help them understand that they are feeling anxious. And so something that a lot of times is helpful is just acknowledging, it's yes, I hear you're anxious and worried about my decision. I'm actually pretty anxious about it too. This is why I'm making the decision. This is how I'm thinking about it or talking through it. So then rather than you facing off, then you kind of bring them over so you're both looking at the same thing. Because that's the reality of it. Both you and your loved one, your partner, your spouse, you're facing the same issue. You're worried about your health. They're worried about your health and how it's going to affect, the rest of your lives. And so if you can say, okay, well, yes, we both are worried about the same thing, as opposed to, why are you so worried about this? It's not something to worry about. It's kind of that's just going to make the person try to convince you that, yes, you do have to worry about this. What's wrong with you? You're not worrying about this. If you say, no, I am worried too, let's look at it together. Let's make sure that we're making this the right decision for us. Then it can kind of diffuse some of that.
Perfect. Absolutely perfect. And as you're speaking, Dr. Shu, I realize I did not have the vocabulary 16 years ago to to say, Wendy, I see you're anxious. I'm anxious too.
Yeah.
And let's speak of our anxiety. Just that topic. We never talked about that, and I shouted at her. And so, being willing to be open about one's own anxiety is a very important thing. Well, are there any other? Actually, we're pretty much on schedule, and I want to honor that. But Dave, do you want to say something briefly, two sentences on the upcoming session next month?
Yes, everyone, we have an incredible doctor who's just been in the world news recently for a discovery of a liquid technique that can detect 50 cancers in an early stage. I'm speaking of the urologist, Dr. Eric Klein, is going to be addressing us on active surveillance next month, the last Saturday of the month, July 31st. It's going to be an incredible presentation from one of the most respected urologists in the world. So I would highly encourage you to be there. That'll be noon Eastern time, July 31st. Set your calendar, because this is going to be an advanced degree on active surveillance for all of us. And I highly encourage you to be there and send in your questions early for us to bring to the doctor. But this is going to be a rare opportunity. He's extremely busy, but he's going to take time out from his schedule to talk to us.
Well, again, a big thank you to Dr. Shu, and thank you for all of those listeners that stayed with us all the way. And so that's the end of the seminar. Thank you all. Take care.
Thank you, Dr. Shu.
Thank you, everyone.
That was
Thank
terrific.
you very much, Dr.
presentation.
Shu. Really, really appreciate it.
You're welcome.
Fantastic.
Have a good weekend, everyone.